Here at MS World, we get to talk to top neurologists and to top MS biostatisticians. And I'm here with probably the world's most esteemed biostatistician for multiple sclerosis, Dr. Gary Cutter, who's a professor of biostatistics at University of Alabama in Birmingham. So Dr. Cutter, tell me, there's a lot of interesting things going on at this meeting, but patients at home sometimes think we talk too much about relapsing MS. What's going on here that has to do with progressive multiple sclerosis?
Well, there was a presentation yesterday by Victor Mark from UAB, so there's a conflict there. But the talk was about a non-pharmacologic therapy for regaining control of arm and potentially even leg usage in progressive MS through constraint induced training, which was demonstrated to work quite well in stroke patients and now is being transferred to the MS world. And I thought that's a pretty exciting new addition to what we can do in progressive MS. Not a treatment in the sense of a drug treatment, and certainly there's a lot of initiatives now looking for forwarding the path for progressive MS, but this is something that could be done in the relatively short term.
Could you tell us a little bit more about how it works? What that means?
In essence, someone who has a limb that either through learned disuse, it's weaker so you don't use it as much, you take the contralateral arm, for example, the other side, the arm that is fully functional, and essentially tie it down. And through this, the thought and the experimental data and some of the ongoing research shows that you develop through neuroplasticity, other pathways in the brain, you begin to gain reuse of the arm. These are small studies right now. They will have to be continued, but in the meantime, it's the kind of therapy that has some promise for people who have lost some use of their arms and/or legs.
Well, Dr. Cutter, thank you so much for sharing with us something that's about progressive MS and also not about a medicine, about other ways that we're thinking about being smart about getting the brain to work even smarter than it is already. So thank you so much for joining us.
Thank you.